Good.
Getting an annual wellness exam is an important part of ensuring that an individual is healthy. The wellness exam consists of both a physical exam and provides risk prevention and health promotion information to the patient. Although important at any age, it's especially critical during adolescence as an individual begins to transition into adulthood. By having an annual exam for this age group, it ensures that the teenager's growth and development is proceeding along expected milestones and can help to identify any health problems that may impact the teen in the long run. These preventative measures ensure that the teen is appropriately developing physically, mentally, emotionally, and that they are up to date on any immunizations that they may need.
Yeah.
Hi, Sophia.
Yep.
Hi.
Hi.
How are you?
I'm fine.
I'm Nicole. I'm a nurse practitioner student. How are you doing?
I'm fine.
Good. It's nice to see you today.
Yeah.
Before we get started, can you tell me your full name and date of birth?
Yeah, Sophia Zimmerman, 11302.
Great. So it looks like you're just here for a wellness exam. This whole thing's probably going to take about 15 minutes.
Okay.
I'm going to ask you a bunch of questions. I want to get to know you better. Before we get started, is there anything you have any concerns about? Anything else you want to talk about today?
No, I'm fine. I don't see why I really have to be here. I'm fine.
Okay. Well, before we get started, I want to remind you that this is a safe space and that it's really important that you're open and honest with me so that we know how to better take care of you.
Yeah. Okay.
Okay. Well, let's get started. How are you feeling today?
I'm fine.
Well, the reason you're here today is just preventative medicine. As you get older, it's going to be important that you do things to take care of yourself, and making sure that you're healthy is just part of that. I see that you have a history of epilepsy and polycystic kidney disease. How are you managing those? You having any problems? Those well controlled?
Yeah, like everything's fine. I haven't had a seizure in like forever, and
That's great. You're
Yeah.
not on any meds for that?
no.
Awesome. That's great.
Yeah. My kidneys are good too. I mean, I haven't noticed anything different.
I'm really happy to hear that you're asymptomatic. You look great. You look like a healthy teenager. Do you have any allergies to any medications?
No.
How about any allergies to food? Any sensitivities to any products?
Mm-mm.
Great. Let's talk about school. How's school going?
I mean, it's fine. I don't really like it, but you know, I still go and stuff.
High school. Necessary evil.
Yeah.
You're a junior at Greenview High School. Is that right?
Yeah.
Awesome. What else do you do besides school? Do you have a job? Do you play sports?
I work at Target right now. I actually really like it.
Great.
They used to give me a discount, so
That's
like,
great.
and I really, really like shopping there. So it's nice because I save money and stuff.
Awesome. What else do you do besides work?
Well, I mean, I go to school and I mainly hang out with my friends and my boyfriend.
Great. Well, I want to talk to you a little bit more about your social life. Talk to me about drugs and alcohol. Do you use either of those?
Like, are you gonna tell my parents?
No. What we talk about today will stay between us.
I mean, like, every once in a while I'll drink something at a party or whatever, but it's not like I drink on my own.
Okay. Do you get drunk when you go to the parties?
I mean, doesn't everybody?
Make sure you're careful with alcohol consumption. Are you blacking out when you drink?
I mean, like, only sometimes.
Be very careful with that, Sophia. You can get into some really dangerous situations, and drinking that much alcohol can be really dangerous.
I mean, I only drink with my friends, so they're like making sure I'm okay.
I'm glad you have friends to take care of you. How about drugs?
Like, my friends really like to smoke pot. I mean, I do it sometimes, but I don't really like it. I mainly do it because it's what my friends do.
Well, I don't think that you necessarily need to use pot if you don't like it, just because your friends do. I certainly don't think they'll mind. It's just more for them. How about smoking? Do you smoke cigarettes?
No, my dad smokes cigarettes and it's gross. So yeah, no, I don't. That's disgusting.
It is gross. I commend you for staying away from those. How about vaping? You know, vape pens are a big thing these days. Do you use those? Any of that?
I got mine taken away. My mom caught it, and she doesn't really understand like that it's not like a huge deal or anything.
Well, I'm gonna agree with your mom, and I think that you shouldn't use them. They haven't been studied very long. And there's a real thing called popcorn lung in young people, which
Gross.
it's gross. It's like cigarettes. It leads to really bad things with your lungs. It makes you very unhealthy. And just stay away from it if you can.
Okay, I mean I don't have it anymore. My mom took it away, so that'll be easy.
Good. Well, tell me more about your boyfriend. You seem to really be into him.
Yeah, he runs track. He actually gave me this shirt to wear. I really, really like him.
What's his name?
John.
Okay, I'm gonna ask you some more questions about your relationship with John. This might be a little bit personal questions, but please be honest with me. Are you guys sexually active? And when I ask that, I'm talking about oral, anal, or vaginal sex.
Are you gonna tell my parents?
No. Again,
Uh,
what we talk about is confidential. I just want to make sure that you're safe and that you're well informed about your health.
then yeah.
Can you tell me a little bit more about your guys' intimate life?
I mean, like, what do you want to know? Like, we had sex.
Are you guys safe? Do you always use condoms? I see here it says you take birth control pills. Do you take those every day? Are you consistent about that?
Well, no, it's kind of hard because they make you take them every single day, and sometimes I forget. Like, it's hard to remember to take a pill every single day.
It is. Something that can help is you can set a timer on your phone to go off at the same time every day that
Yeah.
reminds you, like first thing when you wake up, or at a time before you go to bed, or do it at the same time of day that you do something else.
Yeah,
But
I think one of my friends does it when she brushes her teeth every morning, and that's how she remembers.
perfect.
But sometimes I forget to brush my teeth.
Well, then set an alarm on your phone. It's a little bit concerning to me that you guys don't use condoms regularly and you aren't on birth control, and that you are on birth control but you don't take it regularly, which can really increase your chances for pregnancy. Why don't you guys use condoms regularly?
I don't know, like sometimes we just like hook up and we don't have one, and then like sometimes, you know, he says he likes it better without it, but like, I mean, we use it sometimes.
Sophia, I'm not going to try to scare you, but it's really important that you guys use condoms every time. In Washington State, where you live right now, there's a really high rate of chlamydia between women that are ages 20 to 24.
But I'm 16.
I know, but you're going to be 20 to 24 before you know it, and it's really important that right now you start taking healthy sex practice preventative measures.
I guess that makes sense.
I think that it's really important that we test you for sexually transmitted diseases. I have a lot of patients that I take care of who have been married, who have the same partner, and I'm not saying anything bad about you or your boyfriend, but I think that testing at this point, just to make sure that you're healthy, is a good thing to do. Do you have any issues with that?
No, I mean, yeah, that's fine. I don't feel sick or anything. Like, I feel good. So if you just want to do it to show that I don't have anything, that's fine.
It's great that you feel good, but that's kind of all the more reason to get tested, because a lot of sexually transmitted diseases are asymptomatic, which means that you're not going to have any symptoms, which is why they're easier to spread, because people don't realize that they have something wrong with them.
Oh, I guess that makes sense. Yeah.
Along that line, I see that you're fully vaccinated, but you haven't gotten your HPV.
Yeah, my mom kind
coronavirus
of thinks
vaccine.
that people who get the HPV vaccine, if you get it, you're more likely to have sex. So I remember, like, some of my friends got it, and she was really against it, and maybe that's why I don't have it.
Okay. I'm gonna really recommend that for you. You are having sex, and
Yeah, but my mom doesn't know I am.
I'm not going to tell her. And I think that we could probably look into the vaccine regardless, on the fact that 80% of cervical cancers are caused by HPV strains that are preventable with the vaccine. So I think it's
Okay.
important at this point that we look into it. Okay, Sophia, you're doing great. We're almost done. Next, I want to ask you some questions about your emotional health. It's really important, especially at this age, that we take care of all pieces of you, and that includes your physical health, your mental health, your emotional health. Is that okay?
Yeah, it's fine.
Okay. Well, my first question, I want to talk about your sleep. Like the last month, how has your sleep been? Do you have any problems falling asleep, staying asleep? Are you sleeping all day?
No, I mean, it's fine. Maybe I'm sleeping a little bit more. I don't know. I'm tired. It's really hard to balance school and work and my family, and I want to spend a lot of time with my boyfriend. But I think I might be sleeping a little more.
Okay. Well, it sounds like you have a lot to manage. I understand the balance can be difficult, and I think maybe we can work on some strategies to help you better manage so that you prioritize your sleep. Do you have any difficulty concentrating on day-to-day activities?
No, not really. I mean, unless like my teacher's talking about something I don't really care about, or like if I'm arguing with my mom, I don't listen to her. But no, I'm fine.
I mean, I get it. I'm still a student, so I know that it can be hard to focus in school day in and day out. And I know that when you fight with people that are close to you, it can be distracting and hard to focus. Besides that, do you ever feel like you are not good enough, like you're letting people in your life down?
No, not really. Like if I do really badly on a test or something, then like I like will feel bad about myself. But if I don't think about it, then I'm fine. So yeah.
Sophia, mistakes are a part of life. They're going to happen now. They're going to continue to happen. It's good that you're learning now how to deal with them and that you don't dwell on it. Let's switch gears a little bit. Tell me about your eating habits. What's your diet like? You noticed any variation? Are you getting enough to eat?
Yeah, I think I get enough to eat. Like, I mean, I don't eat breakfast, but I'm not hungry when I wake up. So, yeah.
You're pretty thin.
Yeah. Well, like, I eat lunch at school, so I don't really pack my lunch or anything because I don't like waking up early. So I eat what the cafeteria serves. And then, like, when I go with my boyfriend, we usually get fast food. I really like Chick-fil-A. And then,
Okay.
because he really likes it. And when I'm at home, I eat what my mom and dad cook.
Do they cook?
I mean, they heat stuff up in the microwave.
Who's cooking these days? Well, I know that it's busy and that it's difficult to eat in the morning. I struggle with it too. I'd much rather sleep than get up early, but and I know you've heard the cliche, silly statement that breakfast is the most important meal of the day, but there's some truth behind that. Maybe you could put some granola bars or something easy in your bag, a banana. It's a long time for you to wait from the time you wake up until lunch before you eat anything. And at your age, it's important, especially for your metabolism. You're young, you put a lot of demands on your body.
Yeah, I mean, I guess I could try that. Granola bars are pretty easy, and they sell them at Target, so I could get them at work.
They do, and you can get them for a discount.
Yeah, and sometimes it's hard. Like, I'm really, really hungry by the time lunch hits.
I bet you're starving. I bet you're hangry.
Yeah, I get hangry. That's what my boyfriend says.
It's a little bit more of a serious question. I want to talk about your safety. Do you ever have any thoughts of hurting yourself? Like you'd be better off dead?
No,
How about thoughts of hurting other people?
no.
Do you feel safe at home? Do you
Yep,
feel safe at school?
yep.
Okay. Well, that's good. I'm glad you feel safe. But I also want you to know that if that ever changes, you can come here at any time, and we can help you. We have a lot of resources.
Okay, thanks.
Okay. I think that about sums up our visit for today. Sophia, do you have any more questions that you want to talk to me about?
Nope.
Okay. One more thing I want to talk to you about. I noticed that you are on your phone a lot, just like every teenager. You drove here today, right?
Yeah.
Okay. I want to talk to you about texting and driving. Are you careful about that?
Yeah, if I'm driving, I only use the voice command, so I'm really good about it. Some of my friends text and drive all the time. I don't. I dictate.
Okay, that's great. I mean, it's really dangerous. It's unsafe to be that distracted, and nothing is going to be more important, and it's expensive. Like, if you get pulled over, it's I think like a $300 ticket. So,
Yeah, I'm careful.
okay, great. So anything else? Anything else that you're concerned about that you want to talk about today?
Nope.
All right. Well, I will walk you out, and we'll get you set up to get that blood draw, and we'll get a urine sample to follow up on that sexually transmitted infection testing that we talked about.
Okay, sounds good.
Okay. And then we'll follow up about getting that HPV vaccine as well.
Okay, thank you.
Thanks, Sophia. Nice to meet you.
You too.
Okay, Sophia, well, I'm gonna head up to the front desk and I will put in the orders for the blood draw and the urine test for the sexually transmitted disease testing we talked about.
Okay.
And then I'll follow up with you if there's any results that are concerning.
Okay.
I'll follow up with you regardless, I'll let you know, but,
Okay.
okay?
Yeah.
And then, I will look into your insurance and we'll talk more about that HPV vaccine.
Okay.
Okay?
Sounds good.
All right, Sophia. Well, you have a good day.
Thank you.
All right. Talk to you soon.
Okay, bye.
Bye.
Mhm.